In July 15, Ukraine Media Center starts its operation. My name is Svetlana Cheparenko, and now we will be discussing the tools of the National Healthcare Service of Ukraine to provide the affordable medicines to the citizens of Ukraine. And joining us in the studio is Natalia Husak, head of the National Health Service of Ukraine. Good morning, and I would like to greet you with the Day of Ukrainian Sovereignty, and we would like to thank the Ukrainian Security and Defense Forces for this opportunity to hold events like this and to communicate the truth to all of the world. So, Ms. Natalia, let me start with probably unpleasant question. Yesterday, there was information popping up about law enforcement searching the facilities affiliated with the National Healthcare Service of Ukraine. It's all about embezzlement of funds that were allocated for the patients with orphan diseases. So can you please clarify the situation? Well, yes, there was a number of messages. I don't know how were they communicated by your colleagues, but currently the searches in the health service of Ukraine were not conducted. I don't really know what is a facilities affiliated to National Health Service of Ukraine, but generally the story about the criminal proceedings initiated against providers of medical services is a natural thing for the National Health Service of Ukraine. We are always in close cooperation with the law enforcement of Ukraine when it comes to the fulfillment of their obligations, because we don't have any authorizations when it comes to adding the data to the databases or handing the cases to the National Police of Ukraine or Security Service of Ukraine after our internal monitoring. So within the year 2024 and 2025, upon the results of the monitoring, both factual and automatic, we've handed over the materials about over 70 criminal cases where we needed their support, the support of the law enforcement. And in the majority of the criminal cases that were initiated, I think that yesterday the Ministry of Healthcare was announcing the information about the number of such cases, and in all those cases, the National Health Service of Ukraine is a victim. We try to identify and help to identify the violations. We hand over the cases to the courts, and if within those criminal proceedings the guilt will be proved, well, we will be ready to continue supporting the law enforcement. So when it comes to underprovided services, all of the lack of payments, the information is provided in the website of the National Health Service of Ukraine. As a government agency, we take care about our reputation, and I would like to appeal to every journalist, if such information is being provided, it would be useful to get our comment, because again, it's about the reputation of my colleagues and our agency in general. When it comes to palliative aid, because the information was about the palliative aid, in the second half of the year 24, we had out-of-schedule monitorings by the Ministry of Health of Ukraine, and we had, according to my order, we had certain monitorings of providers of medical services, and the information about those providers were handed over to the law enforcement agencies of Ukraine. I'm not sure the offices of which providers of medical services were searched. Probably it was based on the information that was provided to the law enforcement by the Ministry of Healthcare of Ukraine. Okay, thank you for the clarification. Now let's proceed to the programs that avail Ukrainians to get affordable medicine, specifically the Affordable Medicines Program. Well, what is the phase of its implementation and how does it work in general? Well, I think that among all of the social programs, Affordable Medicines is an exemplary program that works for the people, because within more than 7 years, Ukrainians have been able to get the medicines that they need to maintain their health or to prevent certain diseases Well, they could get those medicines either for free or at very low rate. As an organizer of the program, we enter into agreements with the pharmacies that extend those medicines that are under reimbursement program. They are being sold to the patients, to the clients, basically at very low rate. And even despite the war, the Ministry of Health continues taking care of these programs so that the range of the medicines is being expanded. And this program has two goals, important goals. First of all, to prevent the diseases, just like cardiovascular ones, or to maintain the quality of life, as I've already mentioned. It covers, for example, insulin-dependent patients or immunosuppression. And another component, another goal is to relieve Ukrainians of their financial burden when it comes to procurement of medical drugs. This year, we have an unprecedented scale of the program, more than 6 billion hryvnias of budget funds, half of which were already extended to the pharmacies. And this year, we have an unprecedented expansion of the program. More than 30 new components have emerged in the market. And within the framework of the winter support and within the demographic program, for example, in August, we are about to have an expansion of affordable medicines program for two important medical drugs used by the pregnant women, such as folic acid. And in October, we are going to expand the program to cover the medicines that are required by the oncological patients. Also, there are medical drugs on the list that are being sold under the program, and that this list numbers more than 600 articles, the original names. And program wouldn't have been able to be measured objectively if we had a small number of participants in the market, a small number of pharmacists, and another specific feature of this program is that it's an exemplary program that demonstrates the private and public partnership, because the government, even despite the full-scale invasion, the challenging times, haven't suspended for one single day the sale of the medical drugs at low rate. And in this case, we have to mention that the pharmacies within those years, they were undertaking a social mission, because the medical drugs are being sold at the prices identified as the reference prices, and definitely there may be no story about any price hikes, and we try to fix this price at which we sell the medical drugs. Also, it's important to mention that starting from the 1st of July 2025, we have gotten an important novelty that was implemented by the policies of the Ministry of Health of Ukraine, but it was built on an international experience when all of the drugstores who have relevant license to sell medical drugs should take part in the affordable medicines program. Last year, the Ministry of Healthcare has tried to implement such standard for the drugstores located in the territories of medical facilities. So if you end up in a hospital and you see a pharmacy, they should be a participant of this program. So starting from this year, we've obliged all of the pharmacies to become the members of the program. And now we have more than 2,000 agreements that cover about 68% of all of the legal entities who possess relevant license, I mean the drugstores. So we address the local authorities and our partners so that we should communicate the fact that we are open to the new agreements, that the pharmacists shouldn't violate the requirements and rather join the program, because otherwise the pharmacists may get deprived of the license if they don't get involved in the program. There are no more physical obstacles for this. In the beginning, you had to think that you have to have a computer connected to the National Health Service database, and the employee should be able to register those electronic prescriptions and stuff. But now all of the antibiotics are only sold based on the electronic prescription. I mean, this is the sustainable story for all of the pharmacists, and I see no real obstacles for the rest of the pharmacists that haven't got involved to get involved now. So within which period are they supposed to join? Well, basically, they were until the 1st of July. 1st July next year. No, this year. So basically, they should have already. Yeah, and we understand that those who have not yet joined. I mean, we're observing a daily growth dynamics, the dynamics of growth of agreements, but definitely the service will be working as a regulator which extends the licenses, and now we may initiate investigation about joining the program. We're not talking about suppressing businesses. We wouldn't like to use probably such tools, but we may issue warnings and the rest of the administrative things. But now we're still communicating that we are ready to process the applications of the pharmacists on a daily basis so that this apply and join. Okay, but in order to join the program, for what I understand, the pharmacy is supposed to be selling at least one type of drugs that is on the list of the affordable medicines list. Yes, at least one medicine out of that list. They submit their applications, in which section they would like to join, and respectively they are supposed to have relevant brand names and active components. Well, doesn't it influence the opportunities of the patients to buy some unpopular medicines, not somewhere in Kyiv, but somewhere in the regions? Well, you know, we observe the program developing in part of communication of the pharmacists between themselves, the way they can serve the needs of the patients, because it's a business in there, and obviously, and first of all, the prices, the reference prices, and the applications that are being submitted to the list, they're being submitted by the manufacturers. So the manufacturers, one way or another, sell those medicines to the pharmacists at the prices that are identified by the program. There should be no such thing that something is profitable or unprofitable. It's about helping the patients to become the parts of this program. And in this case, we're seeing the pharmacies like ordering the medicines ahead based on the need of the patients. We can see, and we highlight it because we see such a need. For example, the patients in the website of the National Healthcare Service may see a map. We call it a dashboard, but for the people it can be easier called a map, using which they can filter out some medicines and to see where which pharmacy was selling it within the last 7 days, to understand where to order it faster, to find it faster. On the other hand, we also understand that now there's a lot of platforms that, including electronic platforms, that allow the patients to find the medicines, and we will cooperate with them so that the patients, even using the code from the electronic prescription, could quickly order it in one or another pharmacy. So basically, we see a very positive dynamics. Even our foreign partners mention it. In the year 2023, when we have analyzed in detail the program, whether the medicines were really affordable, well, it's important to take care about the expansion of the list. It's important to take care about the funds involved, because about 5 million Ukrainians, more than 5 million Ukrainians have already taken part in this program since its establishment. But when you understand there are old men or women living alone somewhere in remote areas in the villages, they choose whether they should pay for a bus ticket to go to a regional center to get their free medical aid or to buy that medicine from a pharmacy in their village. You understand that you have to go further. I mean, in terms of this policy, we've seen that unfortunately in 2023, less than 30% of the issued prescriptions in the villages, in the rural areas, were in fact processed. Using the help of USAID, we covered all of the regions. We went through all of them. We met the heads of their territorial communities. We've demonstrated what's going on in their settlements. It can be tracked by the map of the National Health Service of Ukraine because we publish the phases of implementation of the program in terms of different providers of medical services, like who of the family doctors provides prescriptions, who do not. And we've studied those indicators, and we've demonstrated how this system can be improved, how the affordability can be improved using the help of social workers, so that the elderly could be provided with the necessary medicines, or those who ended up in difficult life conditions. Also, we understand that for certain regions, this scheme doesn't fit. They need different solutions, and the National Health Service of Ukraine implemented such a solution as mobile pharmacies in the territories of the active hostilities combat operations. And also there is Ukrposhta as a national communications operator who got joined to the affordable medicines program, and the family doctors can easily order medicines through Ukrposhta for their patients on the affordable medicines program. I mean, those that they deem necessary to be prescribed to this or that patient. Also, we have two more challenges in this program. First is the lack of awareness of the patients. I can judge by my relatives who reside in a small village, and I see grandma having Parkinson's disease, and my aunts, until the very latest times, they didn't know that they can buy some drugs to counter it, and the grandma's pension, it covers some part of the medicines, but the aunts were not aware of it. So it was a large-scale campaign that we highlighted during our regional trips, and thanks to the communication with the regional journalists, we were able to achieve it. And another challenge is the lack of loyalty of certain family doctors. We can see certain manipulations. However, the majority of family doctors, according to the SafeMed survey, evaluate the program and its development as positive. Meanwhile, based on the analytics, we see that we have family doctors who are not quite loyal to the program, and we see it in communications with the patients. Well, this story, we assess it in terms of efficiency of the family doctors' works, and we're looking for the tools to find the solution.
About this program of affordable medicines, the list of the medicines, you said that there are certain medicines that are already provided, which are not, which are still not accessible, which are not still affordable. What should be included? Well, we always holding a hand on the pulse, and first of all, Ministry of the Health of Ukraine, patient organizations, a certain number of other medical institutions, or, for example, Ministry of Finance. They are involved in terms of financial support. Different medical associations also address these questions, I consider this a very positive thing that in the recent year, this program was extended in terms of number of medicines that are being provided to the patients. These are modern combined medicines, and they include the heart medicines, heart disease medicines, and as I said before, according to the decision of the Security Council of Ukraine, the government decided that this list can be and should be extended. And when we were deciding which medicines are to be included in this list, it was important to reflect the demand from the demand that is actually that actually exists among the patients, and that's why we involved different sociological organizations in the framework of this program. We have the services that include different spheres of medical activities. For example, surrogate mothership, the pregnant women support, like for example, folic acid was not in the list, and as we know, this is not a very expensive medicine. However, we don't know if everybody can afford it, so now it is affordable within this program. I think. For 5 years, the patient organizations were lobbying for centralized procurement of these medicines. And this is kind of positive because it means that the government is providing the medicine. However, when this program is implemented, the patient organizations were lobbying for this for many years. However, when it came to practical solutions, it turned out that it is a convenient scheme within which the medicines can be distributed among the patients. However, it is also important to mention that the in-house treatment is also a very important component of the health care, and these medicines naturally are aimed for much more for bigger numbers of patients, and the investments for this particular portion of the program is actually working as well because it is also involving much more complex diseases. And we have statistical data that shows that this program already is showing practical results. Like, for example, some of the diseases that are complex, that are hard to treat, the death rate because of those diseases decreased significantly. Like, for example, the heart diseases, and those are considered complex diseases, and to add to the above mentioned the program of reimbursement, there are medicines that are not procured centrally. These are, for example, like for hormonal medicines, for breast cancer, against breast cancer. So if forming this policy not around the way the medicines are distributed, but rather on the around the demand of the patients is our main method of implementing this program. And also what we are facing is a general disbelief towards the state agencies. Like, for example, people could be saying that, oh, this is a government program, it's not working. But we are still, despite all of this, we are working on gaining the trust among the patients. And we are showing in some cases that it is much more profitable for patients to get medicines using this program. And that's why we're working with the Ministry of Health of Ukraine on adding new and modern innovative medicines into this program. And of course, I would like also to mention that the program of affordable medicines is not the only program that provides medicines to the Ukrainian people. We also have centralized procurement when we're talking about, for example, chemotherapy, or the medicines that are used during infectious diseases, AIDS, tuberculosis, and also in terms of hospital used medicines. We are also covering those as well. A few months ago, we had the civil institution, the Patients of Ukraine, and they said that 8 billion hryvnias are lacking in order to cover all the necessary treatment for the cancer patients. I would like to say that I was watching this campaign, and we are working very closely with this particular organizations, and the budget that is going to be discussed in the Verkhovna Rada in the nearest future. The question of such medicines and the necessity of their procurement in wider volumes, in the bigger volumes, it will be discussed as well. Also, there has been concrete steps, practical steps in this direction, like legal solutions, legal decrees that regulate the medicines accessibility and their distribution in the drugstore networks. And we are seeing good progress in this regard. However, we need to be realists and continuously monitor what are the necessities among the patients of Ukraine, what could be new tendencies, new trends. Also, in 2024, the programs that started in 2024 and afterwards, during the full-scale invasion, it should be noted that we are not having the potentially the full financement that we could have without the war, you know. So with working with the complaints of the patients, we are also seeing that the general culture in the medical in the sphere of medical treatment is kind of still stale. It needs some work, meaning that a lot of explanatory work is required, and marketing. also, at the same time, the National Health Service of Ukraine that is working very closely with the medicines themselves. We are basically going through the list of the required medicines for the existing diseases, and we do have a image of how much money that could be necessary for a full cover of the necessities of the patients in Ukraine. It's around 14 billion hryvnias, and after such monitoring, after we started observing these trends, after the governmental decisions, we have seen that already in the first quarter of the 2025, the medical care providers spent 9 billion of budget finances. And we understand that this is not the final amount. That this is not the final volume, and we are going, and we are ready to continue this work. And family doctors, were there any kind of changes in this regard? How many of them are working in the system, and how many are involved in this system of affordable medicines? During the first medical aid, all the medicines that are used during the first aid are covered by the budget, by this program. So, like for example, children from until 5-year-old, they require a special treatment. This is also taken into account. We're also by procuring 24,000 family doctors. We are providing and all of them together are showing 30 million of income together. And we are also watching, we are trying to follow up on the income of the family doctors. In this, we are working together with the legal entities, governmental entities. We understand that through automatic monitoring and verification, we have to follow up on these things because, for example, the abuse of the system that you mentioned in the beginning of our discussion today, and any kind of journalist basically can accuse our organization of anything they and we have to respond to these things. I think we are we're moving quite successfully along this path, and this means that a portion of the patients will have some kind of, will feel some kind of consequences of this. However, it needs to be said that a huge portion of the medical care providers are still not verified, not licensed, and this should be followed upon. When we're talking about the volumes of medical care volumes, we really don't we don't really cover this question. However, this was the family doctor reform was one of the most successful reforms. They were one of the first ones that were initiated in the domain of medical care provision. And we are the principle of the fundamental basis of our reform is the family doctor has to be an entry point for a patient into the medical health system. So only through family doctor you are getting the further directions, whether which kind of study or examination you are supposed to undergo, and this is exactly the person that has duty to care about your health, not just take care of you, but it has a duty to take care of you. And this is being reflected in the legal field as well, in the legal domain. So we are ready to reimburse to the family doctors if they care about the Ukrainian people. What does it mean? We are ready to buy medicines. We're ready to buy medicines for the cardiovascular diseases, and the so-called prophylactics programs. Like, for example, our colleagues, our foreign colleagues, they have experience in those programs, and we are overtaking this experience. And I'm sorry. Can you please explain how this program is going to work using some kind of example? Is this going to be some kind of list?
Well, let's put it like this. We have the basic volume of the primary medical aid, and we have basic risk categories. Well, there are patients that end up in those risk categories. For example, I'm a representative of an age group in which I need to visit my family doctor even if I don't have any concerns to get my blood pressure measured, to get my overall blood test, to make a cardiogram, to check if the family doctor identifies any developments of cardiovascular diseases, or, for example, as a woman, I have to undergo mammography at least once in 2 years. Well, that's the risk group. So, and people from those risk groups, they will be proactively invited by the state so that they understand that they have this right, so that they can exercise this right, and to help the family doctors to communicate this duty of the joint care. Well, lately there was a lot of discussions with the family doctors about us having a lot of duties, on part of family doctors, and as the procurer of the services, we monitor the operations of the family doctors, but we don't have a duty towards the patients. But I think that it will be the right thing to build the system in such a way that it's not a duty on part of the patients, but it's rather some communication and raising awareness of the patients, because during these challenging times, and I would like to remind you that our challenging times have been protracted, because after the pandemic times, when everybody was caring only not to get infected by COVID, people were afraid to attend public places to avoid it. And then there is the full-scale invasion. Millions of Ukrainians are sleepless in the nights, being concerned about their loved ones, of having been forced to move to different areas. And it's all definitely reflecting on the physical health. And in this case, the state should inform, should raise awareness through the existing or the channels that are being built. And I think that the Ministry of Healthcare are going to initiate some communication in terms of how it's going to happen. So talking about the free of pay services, what are the new services showing up on that list? Well, first of all, we have the program of medical guarantees working in our country. It means the amount of medical services procured by the government so that they are extended to the population for free. And in this case, it involves not only the first medical aid, but also extra medical aid. When Ukrainians call the ambulance, is the specialized medical aid starting from surgery, diagnostic, inpatient care, the treatment of oncological diseases, the birth, delivery, neonatal aid, surgery, one-day surgery. Also, it covers the treatment of strokes, palliative aid, and also psychiatric inpatient aid, and not only inpatient, also in outpatient centers, and it also includes rehabilitation services. Well, this year I think there was nothing extra emergent. We're just trying to double check the tariffs for the services already procured. This year, within the demographic strategy, we got the service of extracorporeal inception. We also compensate the dental services for our veterans, which are in pretty high demand. We see it by the number of people who get those services. Also, the transplantation services were added in 2022 through medical guarantees service. And for example, when it comes to medical guarantees in 2025, the specifics is that we've integrated the facilities of the National Academy of Medical Sciences and the Ministry of Healthcare of Ukraine, and certain facilities of the State Department of Affairs. And now the Ukrainians can already get services there free of charge. And if such services are not provided, they should address the National Health Service of Ukraine. So we consider their reports. Well, Ukraine is on its Euro integration path. A lot of reforms are taking place in different sectors. Are there any changes in provision of medical services, provision of medicines, everything that National Health Service is in charge of? Well, when we were in negotiations with the colleagues from the European Union, the way we entered the negotiations procedure is when we've transformed the national healthcare system. We have a national procurement agencies, just like the European countries have. We have the shaping of the civilized medical services market. We have a relevant policy when all of the services have relevant tariffs, and that's the basics with which we enter the European medical space, European medical environment. Also, we're putting together the electronic database that allows us to keep track of relevant elements such as the electronic prescriptions or the treated cases. And also we're preparing in two fundamental parts that we have as a National Health Service of Ukraine that we have to work through within the framework of our roadmap. The electronic tools such as electronic prescription or electronic reference, the patients will be able to use it in the countries of European Union as soon as we become the full-fledged member. And also we have a directive on implementation of which we're working, the trans-border medical services. It's when Ukrainians will be able to use medical services in other European countries, or the residents of the European countries may use the medical services in Ukraine, and it will be paid by the national insurer, the National Health Service of Ukraine, in case of Ukrainians. And there is meticulous work on the way now. And generally, I like to say that definitely our medical system, or no medical system, I mean, I keep telling it to my colleagues from the European Union that no medical system has undergone transformation under the conditions of two great challenges, pandemic and full-scale invasion. We develop monitoring, we develop our services, and again, getting back to your first question, it becomes only possible thanks to those changes taking place, because previously those services, they could be just abused and submitted to the reimbursement. And what's been manifested now is already the consequence of system becoming transparent and the ability of the system to identify such abuses. And the third challenge that I mentioned is joining the European market, joining the European community. And definitely there will be more challenges such as mobility of the patients, mobility of the doctors, market tariffs, and prevention of corruption in medical system. But we keep working, aiming at good results. Thank you, dear colleagues. Do you happen to have any questions on the floor? Raise your hand in case you want to ask a question. Good afternoon, Olena. And then I would like to get back to the first topic that was touched upon about the searches in the offices of the providers of medical services. The law enforcement said that it was about palliative aid that was provided for the same patients within more than a year. Meanwhile, the directive contemplates 34 days of provision of such services. The scale of abuse says that the ministry and the service could not see the abuses. So what will be the decisions made in this regard? Well, under our procedure, all of the data is added to the electronic database. I'm not aware of this 34-day story or what you've mentioned, because currently we have very strict restrictions in terms of medical guarantees program. When we check the report, whether it was paid or not, there is there are automatic analytical tools that allow us to check whether standard protocols, the standard procedures were complied with. The basic standards that should be adhered to in terms of palliative aid. On top of those algorithms, there are two more tools that I've mentioned, the actual and the automatic monitoring. For example, last year, we've completed the automatic monitoring of the workload. We understand that there is a team of palliative specialists working. They cannot work 26/8. And we've checked the system. What is the workload on the doctors in average? What is the number of patients? And we've come up with the number of providers, including private providers, for whom that load was about the standard, which looked surprising to us. However, we don't have tools that would allow us to study the situation, whether the people were staying there or not is the responsibility of the law enforcement. So we were using our tools. We've implemented the emergency monitoring, and we've seen one of the provider in Kharkiv region. I'm not going to call the name of it because there is the presumption of lack of guilt, and we've identified that the provider was not based there, so we've handed over the cases to the National Police of Ukraine so they could help us with the investigation, because we don't have such authorization as an agency, and the same applies to rehabilitation. On top of that, talking about the system, like whether someone may have seen something or not. The automatic monitoring sees a lot of things. We have more than $2.5 billion of budget funds, and the amount has been recalculated based on the results of the automatic monitoring. And some share is being accounted for by the surgical and palliative aid. So I think that we are going to get ourselves familiarized with the materials of the case, because for us it's a routine story. Let me repeat it once again. We are in constant cooperation with the National Police of Ukraine. We respond to them on a regular basis, because calculation, the services, all those things, our colleagues can only do it thanks to our cooperation, and we keep providing all of the documents when it comes to contractual relations, decipherment of the electronic system, whether there were any key persons involved. The way the system works, and it was proven a number of times within the framework of audits and the cases that are already numerous, that any interference by the management is impossible, because the system is so automated that even if someone would have want to interfere, it's very difficult to do so, and I would say even impossible. So we'll see what's going to happen next, what's going to be the information about this case. When it comes to any personnel replacement, well, I think it's not my responsibility. Well, in case we don't have any more questions on the floor, we would like to thank Ms. Natalia, and let me remind you that we were talking about the tools to ensure affordable medicines and free healthcare services for Ukrainians, and we will continue in a couple of minutes. We will discuss the harvesting amidst the war, so stay tuned.